Karthikeyan sir, start the meeting.
Yes. A very pleasant good morning to one and all present. With pleasure, we are inviting you all to yet another new innovation by RMK Group of Institution, the Generic Talk Series. So, without any delay, we request our beloved, dynamic, and distinguished principal, sir, Dr. K.A. Mohammed Junayed, to give the welcome address. Please, sir.
Thank you, sir. So, good morning, one and all. On behalf of our respected chairman, sir, all the members of the management, faculty members, students, on my own behalf, we wholeheartedly welcome each and every one of you for this lecture on lifestyle modifications by Dr. Thillai Nachiar, Madam, Senior Assistant Professor, Kilpack Medical College. For the benefit of all, this common lecture series has been initiated by our management, and this is the first generic talk series on lifestyle modification in line with Sustainable Development Goals, free, good health and well-being. For the benefit of all of us, we are very fortunate to have Dr. Thillai Nachiar, Madam, from Kilpack Medical College to talk about lifestyle modifications which will lead to good health and well-being of all of us. My dear faculty members, students, parents, and other guests joined in this live streaming organized by RMK Engineering College. Today, this is the first generic talk series organized by Computer Science and Engineering Department of our institution. I also would like to thank all the faculty members and HOD of Computer Science and Engineering Department for identifying such an eminent personality to present about the lifestyle modifications required for each and every one of us in today's scenario. So once again, I thank each and every one of you and welcome each and every one of you for this special lecture. Thank you, one and all.
Thank you, sir. Now I invite Dr. S. Pave Madheshwari, an academic coordinator and head of the department SNH, to felicitate the gathering.
Yes. Thank you. So very good morning and have a pleasant day for every one of you present here. And we are very proud to have this as our initiative. This is the new initiative by our institution, as our principal was telling in his welcome address. We are having the generic talk series, maybe monthly once. And also we are planning for technical talk series also. And this we have started on this day, and we expect this to go for a long run. So every month, let us have something fruitful we are learning. And in long run, we expect our students also to participate in this and present their views on certain topics. And here we focus on the Sustainable Development Goals. For almost all the topics, we will be having the focus on Sustainable Development Goals. And this series will be beneficial for our students, our faculty members, and also the general public. So we are telecasting this in the YouTube, and we are inviting the parents of our students and general public also to view this. So we can consider this as our social responsibility. And in the ancient days, there used to be a proverb called "Jack of all, but master of none," to criticize when we are looking into different fields. But in this current scenario, that is not the case. We all are expected to have a vertical expertise in one of our specializations, and at the same time, we are expected to have the horizontal exposure to all the happenings in and around us. So with this as our motive, we are initiating this on one side on the general happenings, on the other side, the technical topics. So I expect this goes a very long run, and our faculty members and our students and the general public are getting benefited out of this. And all the very best for this initiative. So we pray the Almighty to shower all his blessings on us so that we are continuing our journey in this line also. Thank you. Thank you all.
Thank you, ma'am. Now I invite Dr. T. Sedukarasi, HOD of CSE Department, to introduce our beloved chief guest.
Good morning to all of you. I take this privilege to introduce Dr. Thillai Nachiar, MBBS, DA, MDOG. She completed her MBBS in the year 2004 and Diploma in Anesthesia in the year 2012 and MDOG in the year 2018. She joined in Tamil Nadu Government Service at the year 2005 as PHC Medical Officer in Ramanathapuram District. Came to Chennai in the year 2008, continued her government service, and after her master degree, she worked in Omandurar Medical College and Madras Medical College as assistant professor. Now, she is working in Kilpak Medical College, Department of OG as senior assistant professor. She has presented many papers in national and international conferences in critical obstetrics, epidural labor analgesia. Her area of interest is infertility, laparoscopic surgery, epidural obstetrics, critical obstetrics. I take this privilege on behalf of our RMK family to welcome Dr. Thillai Nachiar to this wonderful session. Welcome you, ma'am, and thank you.
Good morning, ma'am. Good morning to all. Good morning, sir. And a happy and healthy Sunday. So, this is the first week of Sunday. So, this week, Sunday is, we will initiate as a lifestyle modification. So, thank you for this opportunity. And thank you, ma'am. And thank you, sir. So, we'll come to everyone. We need a lifestyle. We should change. Our health life should modify. So what is meant by lifestyle modification? So lifestyle modification involves altering long-term habits, typically by eating, physical activity, and maintaining new behavior for months, years. So what are the 6 dimensions we have to modify this? Emotional wellness, intellectual wellness, spiritual wellness, and occupational wellness, and social wellness and physical wellness. What is meant by emotional wellness? It requires understanding emotions, coping with problems that arise in every day. So we have to be calm and quiet of well-being. And intellectual wellness involves doing to earn and living or contribute to society. And spiritual wellness, it's state of harmony between you and others. We have to keep our mind calm and quiet, the same. Occupational wellness, being able to enjoy what we are having in mind to new ideas and concepts. Next one is social wellness, is the ability to perform social roles effectively and comfortably without harming others. We have to do something for our society. This is one of the social wellness. And physical wellness, we have to improve our physical body by maintained eating right and exercise regularly, avoiding harmful habit, making informed and responsible decision about health, taking medical care when needed, and participating in activities that help to prevent illness. So what are the health problems associated with the lifestyle modification at first? We'll come to detail about this diet, smoking, alcohol consumption, drug addiction, lack of physical activity, and material that environmental pollution causes, also health lifestyle problems, and psychological stress. what are the risk factors we can control our health related issues by diet and body weight and daily levels of physical activity, amount of sun exposure needed for vitamin D. It's essential for our life, and we can control our smoking, alcohol abuse. And uncontrollable factors are age. We can't control this age related problems may occur, but we can reduce by our health lifestyle modifications. And race, we can't change by our race, and gender, male and female gender, we can't change, and hereditary, and this also we can't change. Uncontrollable factors. So diet, everyone knows this, diet is important for health and health related activities, health related problems. And a diet which contains all required amount of food, drinks to supply nutrition, energy for maintaining body cells, tissues, organ for supplying normal growth and development. So everyone knows this. What are the health problems related to diet occurs? These also everyone knows, but which is initiative to change our lifestyle. I'm putting these slides. Increase in sugar intake, consumption of sodas, increase in calorie intake, carbohydrate intake of processed food, decreased egg consumption, usage of processed fat and oils. It causes lack of energy, poor concentration, heart disease, high cholesterol, obesity. So improper lifestyle, it causes overeating, excessive consumption of fat, smoking, drinking, chewing tobacco, sedentary lifestyle, sitting in one place continuously and working without walking, without doing any extra activities, which causes health related issues and lack of exercise. So our previous generations, we know that our previous generations getting up in the early morning, going for they used to start in the work by walking, by doing activities in the early morning itself, and late night they may work, and they are keeping their body every habit by maintaining their health related. They live for more than 8 years, 9 years. But nowadays we are getting up by late, and every work by late night, up to late night we are in sedentary life. So changes all the obesities, body weight, lot of our lifestyles also reduce. Lot of health problems occurs in early life periods, even 30 years, 35 years. Many people are getting heart attack, high cholesterol, diabetes mellitus, all because of this lifestyle changes, modern diet. So what is meant by modern diet is the main reason why all over the world are fatter and
Ma'am, Thillai ma'am.
கட் ஆயிட்டாங்கன்னு நினைக்கிறேன்.
கட் ஆன மாதிரி இருக்குங்க.
இது கால் பண்றேன். ஹலோ மேம், நீங்க கட் ஆயிட்டீங்க.
சேது ஏதாவது டெக்னிக்கல் டிஃபிகல்ட்டியா உங்களுக்கு?
எஸ் மேம், நெட் டிஸ்கனெக்ட் ஆயிருக்கு, ஏதோ கனெக்ட் ஆயிட்டு இருக்காங்க மேம்.
ஓகே.
So, modern diet. Ma'am, am I audible?
Yes ma'am, yes ma'am.
Sorry for the inconvenience. So, we are talking about modern diet. Few things that wrong with modern diet. Sugar intake has increased. Consumption of soda and fruit juices. Calorie intake has increased. People are eating more processed food. Egg consumption has gone down. And usage of processed food, fat and oils. So, keys to have healthy diet. Eat a variety of nutrients, rich foods, and plenty of whole grains, fruits, vegetables. Maintain healthy weight and eat moderate portions and eat regular meals. Reduce, don't eliminate certain foods. Balance your food choice over time. So junk foods, we have to avoid this. Everyone know this. And how we can avoid, we can reduce, we should change our mindset. Junk foods typically ready to eat convenience food contain high levels of saturated fats, salt, sugar, no fruits and vegetables, dietary fibers. Junk foods thus have little or no health benefits. It may contain ingredients considered unhealthy when regularly eaten. Junk foods leads to short, long-term effects like lack of energy, poor concentrations, heart disease, high cholesterol. And so everyone knows this, organic foods and conventional food. What are everyone knows and everyone study from our childhood. So organic foods are natural fertilizer, crop rotations used. Crop rotation by kill weeds, but in conventional food, synthetic chemical fertilizer are using, genetically modified crops are using, and crops killed by herbicides. We know that, but previously but our older generation used organic food and live for long life. So we should change our society and environment to have a healthy food content. And so how we can avoid obesity? So average male requires calories of 2000 to 2300 meals. For females, 1900 to 2100 kilocalories needed for every day. So we have to divide our food by taking carbohydrate, protein, fat. So carbohydrate is 50%, protein is 20%, fat is 30%. We have to divide and eat our food and food habits. And excess energy stored as a fat, particularly males, abdominal regions, that abdominal fat, and females, that fat deposits in the thighs and gluteal regions. And body also requires vitamins, but body cannot store that much vitamins. And minerals also needed to have a healthy body and healthy eatings. So everyone knows, every youngsters, everyone knows smoking, and every movies we are seeing that is smoking injurious to health. Smoking causes cancers. We know that, but how we can avoid? One minute. So how we can avoid this smoking? We should know that. So this is the how it stimulates to have a smoking because of the environmental circumstances stimulates. So how we can change? What are the habits? What are the problems occurs for this health related problems? Smoking is a strong addiction. Increased smoking among youth. Availability of smoking implements such as cigars and short-term effects. Increases heart rate, blood pressure, injury to heart and blood vessels. And long-term effects are loss of appetite, yellowish of teeth, halitosis, bad breath, lung cancer, low sperm count for males, infertility causes infertility in males. And smoking is injurious to health. It impacts smoke in young youth has increased lot problems. So we know that, but we should avoid. It causes a lot of problems to young peoples. And we seen this. It causes lung cancer. Everyone knows these things. And alcoholism. This is also everyone knows. In alcoholism causes a lot of health related problems. Less amount of alcohol may helps to body, but continuous alcohol causes a lot of health related problems, including 65% automobile accidents, violence, suicide, sexual involvement are due to consumption of alcohol. So this is also we have to avoid by particularly young generations. And short-term effects of alcohol causes excessive sweating, blurry vision, nausea, vomiting, slower heart rate, slower breathing rate, increased blood pressure, anxiety, restlessness, mental confusion, and lack of physical activity. We are doing continuously sitting in one place and doing our work, not walking, not doing any extra activities, and sitting from the morning to night. So it causes lot of problems, including stress, relaxation time reduced, not eating healthy diet, and a lot of problems occurs. So benefits of physical activity helps a lot to make our energy, to relieve stress, lower risk of osteoporosis, bone-related problems, and drug addictions. This is also we have to encourage for our younger generations should avoid drugs and drug-related things. And a lot of this heroin, opium, ecstasy, it's our government also restricted one, but it should motivate our students to avoid these things. And technology addictions. This is nowadays in modern society, everyone having a lot of problems. I think principals are having this topic is separate one to how to reduce this addiction. So it causes a lot of, which is usual in our latest society, but it causes a lot of problem, mental and healthy problem also. So it causes depression, dishonesty, feeling of guilt, anxiety, feeling of euphoria, inability to priorities, keep schedules, isolation, no sense of time, defensiveness, avoidance of work, agitation, mood swing, fear, loneliness, boredom, and routine task procrastination. So physical symptoms, internet addictions, backache, carpal tunnel, bone-related problems, headache, insomnia, loss of sleep, poor nutrition, and poor personal hygiene, neck pain, dry eye, other vision problems, weight loss. So due to this internet addictions. So government technological treatment of internet addictions, individual, group, family therapy. So we have to motivate ourselves by self and group, and behavioral modifications, delegation of behavioral therapy and cognitive behavioral therapy, equine therapy, art therapy, recreation therapy, reality therapy. So we should change. We should think that we should control our these addictions. Everyone should change by themselves only, and by helping, by getting help from the nearby our friends and relatives. And environment pollutions. This is another thing we've seen. So this environmental pollution causes a lot of health and health related problems. How we can avoid this? What are the problems occurs? So everyone, as a young generations, we are also part of our society. So how we can reduce it? At least the plastics in our garbage, peoples are asking separate these plastics and separate the biomedical wastage are having. At least we remove the plastic and plastic related products and other garbage in the separate dustbins. We help to our society to avoid this environmental pollutions. So what are the environmental pollution causes health related problems? Air pollutions, asthma, COPD, chronic obstructive pulmonary disorders, and lung cancers. Water pollutions, gastrointestinal, GIT problems, hepatitis A, leptospirosis, and soil pollutions, cholera, liver and kidney disease, malaria, and noise pollutions, deafness, lack of concentration, heart disease occurs. And stress. Everyone knows this. Stress nowadays, even younger age group, even childhood to adult, everyone has a stress. How we can avoid this stress? So modern life is full of hassles, deadlines, frustration, demand. Work can be stress place, whether it's office, factory, school. Too much stress is bad. It leads to serious health problems. Stress disturbs nearly even systems in our body. So it will raise blood pressure, suppress immunity system, increase risk of heart attack, stroke, contribute to infertility, speed up of aging process, decrease digestion, sleep problem, depression. So preventive measures, how we can prevent this stress? We can have a balanced diet, avoid junk foods, and avoid smoking, avoid alcohol, avoid drugs. So we can have a health, walking, exercise. So this lifestyle modifications, changing ourselves, emotional, happy, well-being, reduces the stress. So 15 ways to boost metabolisms, burn calories, plenty of water, good sleep, green tea, small meals often, spices in diet, protein and vegetables, muscle building exercise, high intensity intervals in workouts, high fiber food, keep moving and changing position, change temperature, cardiovascular and aerobic exercise, laugh often, sufficient iron, stretching exercise. It boosts our immune system and body. So these are all the general topic for both male and female health related problems. And we'll come to our, particularly for our women lifestyle modifications. This is many women undergoes this polycystic ovarian syndrome, particularly adolescent girls, for reduced physical activity, lifestyle modifications. So what are the things, pathophysiological signs and symptoms we'll come to. What is this PCOS? Most of the young generations having this PCOS, particularly after this corona, having increased PCOS. For my clinic, my hospitals, many young generations are coming with this PCOS. What are the symptoms and signs having this PCOS? This is described as Thillai syndrome, and it causes female infertility. Will come to this. What is PCOS? Polycystic ovarian syndrome, common endocrine dysfunctions, oligo-ovulations and ovulation, signs of androgen excess, male pattern, male hormone secreted in females, multiple small ovarian cysts. So this PCOS is most common disorder of reproductive age women, affects 4 to 12% of women. PCOS appears equally, affects all races and nationalities, and increases the genetic peoples also. So again, the PCOS, first line of management is lifestyle modifications. So particularly sitting in one place, doing without any extra activities, changing our food and food habits. So lifestyle modification. So treatment is lifestyle modification, exercise, diet, and it all helps to reduce the androgen exposure. That means male hormone reduce the male hormone in female patterns. So interaction of genetics and environment. So pathophysiology. So this is a HPO axis. We told us a HPO axis, hypothalamo, pituitary, ovary to uterus. So pituitary reduces the hormones. So multiple follicles develop in the ovaries, and periods, menstrual problem occurs in the woman. So these are all the pathophysiology. Excess LH and low FSH. Hypersecretion of male hormones in females, negative feedback. These are also hormonal related problems. And what are the things happen? I'll show in the picture to the every woman in ovary. It's a hardened like rock-like ovaries. It's a multiple small follicles forms, and it causes hyperinsulinemia. Hyperinsulinemia, it's the young age group people having a type 2 diabetes. Hyperinsulinemia causes increased resistance. So these PCOS, long-term PCOS causes diabetes mellitus, even young childhood, and hyperlipidemia. That means excess cholesterol forms in young child girls. So what are the clinical features? Hirsutism, the male pattern of hairs occurs in the females, acne, irregular menses, causes infertility, obesity, So type 2 diabetes mellitus, cholesterol, cardiovascular disease in young age. So this is acne. So this acne, we can identify the females as a who are all having PCOS, polycystic woman, by external appearance. They used to have this acne and male pattern of hairs in the female, and irregular menses, oligomenorrhea. They will not get periods for more than 6 months, even 1 year, irregular periods. And later on, they may cause infertility, childbearing difficulties. So because of infertility, obesity, excess weight, obesity, they used to have central obesity, excess thigh fat, and causes irregular periods and cardiac problems. And many women, the PCOS women having this acanthosis nigrans, hyperpigmentation over the back. So we can identify by clinically itself. So this is clinical appearance, that acne, excess hair pattern, this acanthosis nigrans. And we can diagnose by ultrasound. This is particularly in the ovary has multiple small follicles in the ultrasound develops. So it causes not proper ovulating these women having irregular cycles. So all irregular cycles, etc., infertility, obesity, everything, diabetes, cardiovascular disease, hyperlipidemia, later on causes endometrial cancers related to this PCOS. All this we discussed. All this because of our lifestyle modifications. How we can change our lifestyle modifications. So treatment, first line treatment of this PCOS itself is lifestyle modifications and exercise, walking, diet habit, and changing our lifestyles. It reduces all these hormonal changes that anti-androgen gives, these anti-androgens and insulin lower. Later on only we'll go for this hormonal tablets. So weight reduction, slow carbohydrate diets, sustained regular exercise. It helps to all the improvements, these symptoms, particularly without medications itself, we can reduce this PCOS. So insulin, these are all the hormone, this is the tablet we used to prescribe for young, that PCOS women. And thank you. I think it will be helpful for young and energetic people of lifestyle modification in the Sunday morning to avoid alcohol, consumption of alcohol and smoking, and this healthy food and diet and addiction of mobiles and infertility and women's having problem in the PCOS. How we can reduce this? I think so. Last one video, it will be helpful for young people. I think so. Only one video. Ma'am, that video.
குடும்பத்து பையன் பேமெண்ட் கிளம்பி வந்து ஒரு சாதாரண குடும்பத்து பையன் பேமெண்ட் கேட்வே அப்படிங்கிற டெக்னாலஜி வழியா சாமானிய மனிதர்கள், சிறு சிறு வியாபாரிகளை பெரிய அளவுக்கு சென்றடைந்திருக்கிறார். தமிழ்நாடு பேஸ்டு கம்பெனி, அதான் ரொம்ப முக்கியமான விஷயம். இப்போ பையனுடைய கோ-ஃபவுண்டர் அண்ட் சிஇஓ மிஸ்டர் மோகன். வணக்கம்.
சென்னையில ஒரு ஃபின்டெக் ஸ்டார்ட் ஆச்சரியமா இருக்கு அப்படின்னு ஒருத்தர் சொன்னாரு. எனி ஆஃப் யுவர் ஃபவுண்டர் கேம் ஃப்ரம் IIT IIMனு ஒருத்தர் கேட்டாரு. என் ஸ்கின் கலர் பார்த்து இன்வெஸ்ட் பண்ணாதவங்களும் இருக்காங்க.
ஓ, இன்னும் அதெல்லாம் இருக்கு?
அதெல்லாம் இருக்கு, டெஃபினட்டா இருக்கு. அவங்க சொல்ல மாட்டாங்க.
நார்மலா உங்க பகுதிகளெல்லாம் பாத்தீங்கன்னா இந்த மாதிரி படிச்சு முடிச்ச உடனே பெரும்பாலும் நிறைய பேர் போறது வந்து அப்ராட் போவாங்க. உங்களுக்கு அந்த மாதிரி ஆப்பர்ச்சுனிட்டிஸ் இல்லையா?
எங்க ஊர்லயே 95% வந்து பாத்தீங்கன்னா ஃபாரின்ல லேபரா தான் போவாங்க. அவங்க அப்படி ஷார்ஜால போய் ஒர்க் பண்ணாங்க. என்னங்க ஷிப்ல வேலைன்னு சொல்லி கூப்பிட்டு வந்தீங்க, இப்ப வந்து திருப்பி அதே வேலையை இங்க பண்ண சொல்றீங்களே அப்படின்னு ஓனர் சொன்னாராம். பெரிய மெரைன் இன்ஜினியர் படிச்சு வந்திருக்க, போடா போய் வேலையை பாடுறா அப்படின்னு சொல்லி நம்ம பையனை எப்படியாவது படிக்க வச்சு துபாயில வந்து ஒரு கம்ப்யூட்டர் வேலை வாங்கி கொடுத்தாரணும். அதை என்கிட்ட அடிக்கடி சொல்லிட்டே இருப்பாங்க. எனக்கு வேற ஒரு நோக்கம் இருந்தது. நான் துபாய் போவேன், ஆனா அங்க போய் ஒரு பிசினஸ் தான் பண்ணுவேன், ஒரு ஆண்டர்பிரனர் தான் அங்க போவேன்னு சொல்லி லட்சியத்தோட இருந்தேன். செகண்டா நான் ஒர்க் பண்ண கம்பெனி 15 days ஒர்க் பண்ண கம்பெனி. என்னுடைய பாஸ்ட் எவ்வளவோ ட்ரை பண்ணேன், எனக்கு ஒரு வாய்ப்பு கொடுங்க, எனக்கு நீங்க வாய்ப்பு கொடுத்தா கண்டிப்பா என்னால ப்ரூவ் பண்ண முடியும் அப்படின்ட்டு. நான் வாய்ப்பு கொடுக்கல. ஸோ உடனே கம்பெனி விட்டு வெளில போன்னு சொல்லிட்டாங்க. தோல்வியை நம்மளால தாங்கிக்க முடியல. இனிமே நம்ம லைஃப்ல யாருமே நம்மள ஃபயர் பண்ணக்கூடாது. நம்ம என்ன போய் மனசாட்சி சொல்லுது, அப்ப நீ தான் ஓனர் ஆகணும். அன்னைக்கு முடிவு பண்ணதான் ரோம் சாஃப்ட்.
So this is very short video. He's my nearby village software engineer. So he's developed by own Opay. He particularly this video is available in YouTube. He told that he used to do regular routine physical activity, helps to improve his knowledge to business, to help and active. He developed his own software company by himself. He is having more than 350 people's lot of involvement. He did this software, and now he's grown up. He's my relative neighborhood village software engineer developed this. So this is short video to present you all, and thank you so much. Any doubt related to this health disorders and irregular cycles, females and males can ask me now. Thank you, ma'am. Any doubts?
Good morning, ma'am.
Good morning. Yes, please. Yes,
Actually,
please.
thank you so much for this meet, ma'am. It was very helpful.
Okay.
So my question is regarding the mental health, ma'am.
Yes.
Like mental and physical too. Now students are in placement phase, and we are trying to cope up with the stress regarding this placement phase. How to handle mental health, the stress and stuff. And now seeing you talk for 1 week, we'll do exercises. For sure, we'll do. Okay, we have to stay motivated. But then after 1 week, we'll leave it. So this is the cycle it is going on, right? So how to stay motivated, both mental and physical, ma'am?
Yeah, but you from the early morning activity helps your body, mental, and relieve stress activity by early morning walking. It helps for your whole day active, become active. And you initially it's tough for regular exercise, walking. So once you practiced for at least a month, you cannot leave that. If you do that walking or exercise, if after 1 month you that is your part of routine activity, you will not leave that. So if you are doing that, it will help to whole day active. And it leaves, and once you wake up in the early morning and you are doing activity, and your routine, early planning itself, everything you can go earlier, you can finish all your works, everything, the whole day will be calm and quiet. It relieves the stress. So practice yourself, at least initially it's tough only, at least continue for at least 1 month. It helps to keep your mental and physical activity cool and calm, and reduce the stress also, I think so.
Thank you, ma'am. Thank you so
Tough
much.
only. Yeah. Thank you. Anybody? Any questions?
Ma'am, good morning, ma'am.
Yes, please. Yes.
Ma'am, I have a doubt, like for hemoglobin content, in order to get increased, what are the steps to be done, ma'am? Other than taking healthy foods, any other steps to be taken, ma'am?
Yeah, and in childhood itself, we studied in many books, and food and food habits, green leaf vegetables and carrot, and the dates and dry fruits, and these things increases our content of iron. And deworming every 6 months once needed to reduce the iron loss from our body. So deworming is important, and iron food and iron rich food is important. I mean, food, we can reduce iron loss by food itself. So taking healthy diet. That iron anemia itself causes loss of memory, anemic tiredness, dullness, and so all the particularly menstruating women keep the iron level more than 11. It's very, very important to increase your capacity, memorizing power, and avoid depression, dullness. So all the women and male, everyone, all our peoples, we have to keep our iron level at least more than 11. It's important. So
Okay, thank you.
less than very pale. So you should check your hemoglobin level. If it is less than 9, you have to take the iron tablet and improve your iron level up to 11. It's very, very important too, particularly for women.
Yes, thank you, ma'am.
Doctor,
Yes, ma'am.
recently I saw a video where they
Yes,
say
ma'am.
that fermented rice, our Palaya Sadam, that
Yes,
is
ma'am.
very, very good for our health. And as she is asking, it is
Yes,
good
ma'am.
for hemoglobin, it is good for immunity, all medical benefits he is telling for that fermented rice. Is
Yes,
it
ma'am.
so? But we have a thought that if we are eating that, we will put overweight and such things we are avoiding.
Yes, ma'am. Yesterday also, I saw this video also yesterday itself in some status. But once of olden days, they had this kind of food. Our old generations and previous generations had this kind of food. That previous day, that legumes, lot of that microorganisms develop this. That old rice, so it helps increase our immunity like that. But nowadays, but with that they are doing more extra activities. So if we are taking that old rice, that ragi rice and ragi things, it helps to our body. But meanwhile, we have to go for our physical activity is also important. Without that, I think it will not help. Even that is good. Meanwhile, we have to go for our activity, physical and exercise. It's important.
Thank you. Thank you.
Good morning, ma'am.
Yes, please.
So I actually do a lot of workouts. I'm a regular, I follow regular workout, and I don't take any, carbohydrates or more calorie intake food, but still I feel like I kind of have a mild PCO problem and
Okay.
the painful menstruation. So is there any other than that I should keep in mind, like diet and exercise?
Yeah, there are PCOS, thin PCOS and obese PCOS are there. Even thin people also having PCOS. So for PCOS, what we suggest exercise, lifestyle. This is first line management. Exercise, lifestyle modification is important for PCOS. Meanwhile, we have to divide our food like carbohydrate, protein, fat, everything. We have to divide and calculate and important for our life. So, and if you are still having PCOS, you check your hormone level, thyroid and prolactin level. That is also we have to control that. It helps to maintain your menstrual problem also, I think so.
Thank you, ma'am.
Good morning, ma'am.
Yes, please. Yes.
Okay, ma'am. Many of my friends are going for gyms like that. So,
Yes,
is it really necessary to go to gym for make ourselves fit or keep our body active? Like they are saying it. Some people are saying it is affecting our health. Gym is not needed. Yoga is preferable. Or some people are saying only if we go to gym we can be fit and it will be healthy lifestyle like that.
That's my personal opinion. What somewhat we have to be do. Either in the home itself we can do, and our exercise, our yoga and active, not in sitting one place. Most of us, we are sitting in one place for more than 8 plus 10 hours. So we have to go by walk or go by running or exercising, that yoga exercise. So what some way we have to do our our body and keep our body to be active. Either form, not necessary only gym, not necessary only yoga. So what are the way it helps to boost your mind? It release by early morning walking or late night walking or evening walking or morning walking or yoga or with your friends. You are doing yoga or with your friends, you are going for gym. It helps. Your physical activity helps. So somewhat, some way you keep your physical activity by some way. It helps to prevent a lot of problems. So not only these things, not only yoga, not only gym. So which likes you can go. That is my personal opinion.
Thank you, ma'am.
Yes, please.
Madam, good morning, ma'am.
Yes, please. Yes, please.
Ma'am, can we do exercise if we feel like tired? Right? Assume that I am doing a regular exercise.
Okay, fine.
Feel like tired, can we do exercise?
Diet. Are you asking diet?
No, exercise.
Exercise?
If I feel tired.
Tired, yeah.
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 Okay. Can I do exercise?
No, take time, take between rest and do at least what our book says, 20 to 30 minutes of exercise weekly, 5 days. At least. Not by continuous, not by 1 hour, not by 2 hours is not enough. At least 20 to 30 minutes per day for 4 to 5 days per week is enough. No need. If I didn't do for my exercise for 1 day, this day I was busy, I had an exam, so I missed. No need to worry. 5 days is enough per week. So if you feel tired, take rest, take a lot of water and juices and fresh yourself, and next day you can do that, your exercise. Not to even tired, no need to do, I think so. It causes our body health problem also. Take a lot of water and juices to improve health. Thank you. Next, any doubt?
Ma'am, good morning.
Yes, please. Good morning.
Can you please tell about the problems we face when our sleep cycle is affected, ma'am?
Pardon?
Can you tell about the problems we face when our sleep cycle is affected, ma'am?
Sleep cycles, everyone knows this. We are late night. We have to schedule our life in the morning to night. How many hours we are going to study? How many hours we are going to take our health activity, lifestyle modifications? How many hours we are going to study in the evening? When we are going to sleep? Everything in the morning itself, in the early morning itself, everyone we planned. So late night, that's again I'm telling that mobile addictions, everyone after watching some video only we are going to sleep. So one video goes to next video goes to third video, it continues. So it happens the late night. So it disturbs the sleep, the late morning wake up, and it causes continues the next day. It causes stress. Everything, all this happened. Most of the particularly most of the, not only youngsters, all the old peoples, even doctors also say this is, we are going to addictions. So it causes sleep disturbances. So if we are planning our life from the morning to night, we can try to at least half an hour, 15 minutes, we can adjust that self. At least we have to finish every day activity, planned activity, we can go for good sleep. I think so. So it helps your mental and health also good. That's why we should plan our day of life. It will give good day of sleep. We should avoid our addiction also. That is my opinion.
Thank you, ma'am.
What about you? Are you watching late night?
Not that much, ma'am.
Pardon?
Not that much, ma'am.
Not much. Very good. Very good.
Thank you, ma'am.
Thank you.
Ma'am?
Please.
Ma'am, can you brief us on the difference between PCOS and PCOD, ma'am?
Yeah, please, yes. PCOS is a syndrome that I told. PCOD is the only It's a polycystic ovarian disease. That means ovary problem, it causes irregular cycles. That pituitary ovarian hypothalamic axis changes ovary to the uterus. It only PCOD disease. The long term of this PCOD causes metabolic syndrome, polycystic ovarian syndrome. It causes obesity, hyperlipidemia, and high cholesterol, type 2 diabetes in later life, and causes myocardial infarctions. So multiple hormonal related activities, that male hormone pattern, and acne, including not only this pelvic organ, it affects all the other system of the body that causes syndrome, which is polycystic ovarian syndrome. Only this pelvic organ disease is polycystic ovarian disease. So later life, continuous PCOD causes PCOS syndrome.
So, ma'am, if a person is with the PCOD for like 4 years, is they likely to get PCOS, that is changed to PCOS?
Yeah. We have to correct. We have to correct our PCOD in the early itself by first line management, lifestyle modifications. We have to change our lifestyle by using the excess fat and body weight and type 2 diabetes, excess glycogen deposit. We have to avoid in the early PCOD itself. It reduces the PCOS syndrome. It reduces the PCOS in the later life. Particularly, many patients we had in the corona period, but they didn't go for a checkup. If they are having missed periods for more than 6 months, 1 year, even I did more than 6 to 7 surgeries of PCOS with large ovarian cysts. Usually, the PCOS women have small multiple cysts. It may go for simple cyst, 5 x 5 centimeter ovarian cyst. We may operate easily. Particularly this corona period, they self-medicated, or they without periods, they were in the home itself. For after 1 or 2 years, they had a large ovarian cyst. It's almost a big baby of cyst inside the abdominal cavity. We removed. So it is one of the complications with this polycystic ovarian disease, and it causes syndrome later life. So yeah, at least 1 or 2 missed periods, we have to consult gynecologist, and we have to correct our irregular cycles.
Ma'am,
yes, please. Yeah.
What if the cyst is in like 8 mm like that, ma'am?
That small cyst, long term without correcting periods, it may grow big size. We used to tell in centimeter. So mm is small. The centimeter is large, goes up large size of ovarian cyst.
Okay.
Yeah.
Thank you, ma'am.
Yes, thank you. Anyone?
Good morning, ma'am.
Yes, please.
Ma'am, I would like to ask if period cycle and the hemoglobin content, like period irregularity and the hemoglobin content is related, and does it cause weight loss?
Yeah. Period irregularity that I told that a mechanism of HPOC, hypothalamus, pituitary ovary to uterus, endometrial cavity. It alters this cycle. So anyway, any break in this chain, it causes irregular periods or heavy flow, excess flow. If particularly every woman's having 28-day cycles, particularly 5 days, it's normal cycles. It's more than 7 days is heavy flow. So we have to correct our menstrual cycle by within 5 days is good. So excess loss of menstrual flow causes hemoglobin loss. I told hemoglobin loss is causes anemia, and anemia causes all the stress, mental depression, anxiety, lethargy, not concentrating power, poor immunity. It causes that menstrual flow and this anemia, it's interlinked. So we should not go long excessive blood loss during this menstrual cycle. So we have to correct by some hormonal pills needed. So we have to consult our gynecologist and correct that irregular cycles, excessive flow, and correct our anemia level also. Hemoglobin should be controlled within the range.
Okay. Ma'am, does this cause weight loss, ma'am? Like, I lost like around 5 kgs in a month and again 2 kgs in 15 days.
Okay. This is weight loss in young age group, not taking proper food. No skipping. Yeah.
Ma'am, like I eat well, like I don't like skip meals or do like eat any junk food that much, but I don't really understand why I'm losing weight.
Take deworming tablet and correct your anemia level and take proper food. Not taking morning heavy food, afternoon heavy food. In between meal is enough. Small quantity in between, and 11 o'clock some break, and 4 o'clock some nuts and some protein content diet. So a small split meal is food is important. Split 3 times food we have to take 6 times in between meals. So in young people's take a lot of food is important to health, increase your body weight. Should not skip your food.
Okay, like I'm maintaining that diet now.
Okay, but you are losing your body. Take deworming tablet.
Okay, like my hemoglobin content is 8.3, ma'am. Recently I got my hemoglobin test.
So you should improve your hemoglobin by taking oral tablet, iron tablet, and maintain the hemoglobin above 11 is important. As per WHO criteria, you have to maintain your hemoglobin above 11.
Okay, thank you.
Morning, ma'am.
Yes, ma'am.
Ma'am, could you let us know how can we improve low blood pressure, ma'am?
Low blood pressure. So stress release itself reduces the BP. So we have to keep our mind and body by relieving the stress itself first, and reduces the salt. That excess cholesterol causes increasing BP and blood pressure by physical exercise and reducing the body weight, cholesterol content, low salt intake. Daily we need 5 grams of salt. We can reduce some salt, but it's not needed in the young age group. So it's more 35 to 40 years, we can reduce the salt. No need to reduce salt in young energetic peoples. So particularly good sleep and the stress itself reduces the blood pressure. Old age only needed to concentrate that cholesterol and salt reductions, and physical fitness is important to reduce the BP, blood pressure.
Ma'am, good morning, ma'am.
Yes, please.
Ma'am, when you're talking about the cholesterol, I have a question.
Yes, please.
How to increase the HDL level, ma'am? High density HDL cholesterol level.
High density. So that oil. Nowadays they are telling that oil content, cardio oil and various level good oil, what they're telling that naturally prepared oils. So that oil is important to maintain the cholesterol, not having that saturated, unsaturated fatty acids we have to maintain. So excessive unwanted repeated heating of oils we should avoid. That increase LDL level. LDL is bad cholesterol. HDL is good cholesterol. We should maintain our good cholesterol. It protects our immunity. It kills an unwanted fat in our body. So how we maintain means having good oil food, having good oil food, and again we should avoid our obesity. Itself it improves our HDL level. That it reduces central body fat, that it reduced. We should reduce that. Naturally, our HDL will low down. Our LDL will improve. So that helps.
Thank you, ma'am. Thank you, ma'am.
Please. Anybody, any thoughts?
I would like to ask the final two questions of the
Yes,
session
please.
Q&A, ma'am.
Yes, please.
Ma'am, good morning, ma'am, first of all. And ma'am, my first question is that especially youngsters in these days, ma'am, are regularly saying that they are very stressful. So is there any advice for the youngsters today, especially the students who are going to college and they are maintaining everything? So for those youngsters, is there any possibility to how to manage the stress? What stress management is about? Any advice on that, ma'am, for youngsters?
Yeah, particularly we should not force them to do unwanted, uninterested topics. Or as we are as a professor, we are as assistant professor, we have to create interest to them. Without interest, we should not force. That without interest, everyone, even we are having stress. So we have to, as our profession, our teaching professions, we should create interest. So even childhood, if we are having interest, we'll study with the teachers. If we like our teachers, we study well. We like our the environment, we'll do our best. So everyone should or create the interest. Automatically, our stress will go. Automatically, we'll study well. Our stress will get down. So that stress particularly occurs by the surroundings, environment, our friends and relatives, family. So everything should circle by themselves. We change our lifestyle by circumstances. That keeps motivating by ourselves, reduce the stress. It's my opinion. Next, sir.
Yes, ma'am. The last one, ma'am. Ma'am, in any job profession, there will be stress, ma'am. Whatever may be the job profession it may be, especially for working women.
Yeah.
So I just want to ask you this: how are you maintaining your work life and professional life in a healthier manner, ma'am? In mental health of state, I'm asking.
Yeah. So everyone, our boss will scold us, our professor will scold us. Students, a lot of not studying itself, we are having stress. So everyone, that we should not go into our one day we may go stress, another day we may happy, some enjoyment. So that's ups and down will be there. That stress we should not go into deep in our mind. So okay, we'll go like superficially. It may next day we may go for happily. So everything we have to take as a lightly, not be serious. We have to do regular, as much as our work, we have to continue as much as possible. At least we can't do 100% perfect. At least we can maintain our work by 80 to 90%. That helps good our healthy mental life. It releases stress. At least we can try to do our work best. It helps to reduce our stress. Yes.
Okay.
Yesterday, one of my junior told put on YouTube. Daily alaygal போயிட்டே தான் இருக்கும். The waves from the sea comes and down. We cannot change. So some stress will come, some stress will go. Some happiness will come, some happiness will go. So we can change our life by some sort of stress. So not to deep, not to go into the deep level. Everyone, we should boost ourselves by self, by friends or by teachers, by healthy, warmer people. We can boost ourselves. That's my opinion.
Wow, nice, ma'am. Thank you, ma'am. Thank you.
Ma'am, as a summary, I would like to get from you that lifestyle modifications in terms of the younger generation. I would like to hear from you as a summary of the lecture.
So what is take-home message? So
yes.
Take-home message, early morning duty, early morning planning for whole day. We should cover our whole day planning by 80 to 90% of mental and physical activity. It helps our stress and body related health activities. That's my advice.
Thank you, ma'am.
Next இதுக்கு போங்கம்மா. சேது.
Yes, ma'am. Yes, ma'am. Propose the vote of thanks, ma'am.
Yes, ma'am. So it has been such an honor to be a part of this wonderful event. So on behalf of all present, I would like to extend my heartfelt gratitude to our esteemed guest, Dr. Thillai Nachiar, Senior Assistant Professor, Kilpack Medical College, for taking her time in her busy schedule for our first generic talk series. Thank you, ma'am, for sharing valuable information to prepare our students for a healthy lifestyle. My sincere thanks to our management, especially to our beloved Vice Chairman, sir, for giving permission and motivating us constantly to arrange such an unique event. I wholeheartedly thank our beloved Principal, sir, and Dr. K.A. Muhammad Junaid, RMK Engineering College, for his support and encouragement to organize this event. Thank you, sir. I also thank Dr. S. Pave Madheshwari, our academic coordinator, RMK Engineering College, for facilitating the event. I thank Dr. T. Sedukasi, Head of the Department of Computer Science and Engineering, for their support, motivation to start this generic talk series. A wide round of applause and thanks to all the heads of the department, faculties, and coordinators who made this event a memorable one. Finally, I would like to thank all my dear students present and make this event a grand success. So until we meet in the next generic talk series, it's Karthikeyan signing off. Thank you all. Thank you, sir. Thank you, ma'am.
Thank you.
Thank you, ma'am.
Thank you. Thank you, sir.
Thank you, sir. So we'll end